Hilde Belizaire has gone into labour with her first child, but something is wrong. Her husband has brought her here, to a hospital specialising in obstetrical emergencies, run by international aid group Médecins Sans Frontières in the Haitian capital Port-au-Prince. The hospital, which is known by the French acronym CRUEL, only accepts high-risk and emergency cases, so Hilde is evaluated to see if she meets the hospital's strict criteria. She does. It turns out she's suffering from preeclampsia, a dangerous rise in blood pressure that can lead to life-threatening complications. Mothers and babies have a higher chance of dying in this Caribbean country than anywhere else in the Western Hemisphere. Haiti is also the poorest country in the region, so it's no surprise that the public health service is woefully underfunded and unable to cope with a birth rate that is twice as high as in the United States.
Mais CRUEL, vraiment, notre fierté, c'est qu'on puisse assurer qu'il y a des ressources humaines disponibles 24 heures sur 24 et que les femmes trouvent tout ce qu'il faut pour sauver leur vie 24 heures sur 24 à CRUEL. Donc chaque fois qu'il y a une femme qui est rentrée en mauvais état et qui sort avec le sourire, nous aussi on est contents. Tous les jours on sauve des vies.
But not all can be saved. Dieulet Joseph is consumed with guilt. She was 5 months pregnant when she suffered a hemorrhage. Instead of going straight to hospital, she went to a traditional Haitian healer who prescribed her herbal tea. A week later, she finally arrived at CRUEL, but by then it was too late.
Ça fait 8 jours. Si je prends plus bonheur, je vais plus chance de sauver mon enfant, même dans la négligence, à cause de thé à ma boire. On vient de penser que je vais reçu. Eh bien, en arrivant hier soir, 9h du soir, le docteur Bamgan, l'aile Bamgan, les joindre, qu'a engagé, de toute façon, il fait ça le capable. Elle retire, jeune, qu'a perdu. Moi, je suis même mourir parce que il est en fait 2 œufs fer.
Things are looking up for Hilde. Within an hour of arriving at the hospital, she's in the delivery room and the birth is going well. Cayenne Jeudi has also just delivered, in her case twins, the second one breech. These babies are lucky. When she came in, Cayenne had been well past her due date, suffering from hypertension, and had been turned away from at least 4 other hospitals before she was admitted to this clinic. The hospital is in overdrive. It has room for 110 mothers and 40 babies. Doctors, nurses and cleaners are all coping with as many as 800 births a month, and even more during the peak season, which is right now, roughly 9 months after Carnival. Ambulances regularly pull up with urgent cases. Dr. Sena Delva says that some women wait until the very last minute before going to CRUEL, knowing that if they're in labour, they won't be turned away, whether they meet the strict criteria or not. But some women who've arrived hoping to be treated do not meet the admissions requirements, and they have to be sent elsewhere, usually to one of the 10 or so state-run hospitals in Port-au-Prince. This is a ward in the main public general hospital. Conditions here leave much to be desired. It's dirty, and patients have to buy their own medicines. Almost 60% of Haiti's 11 million people live in grinding poverty. So CRUEL fills a much-needed gap, offering quality emergency maternity care, free of charge. Across the country, thousands of people are still not living in proper homes. A devastating earthquake flattened much of the capital in 2010. In October this year, adding to the country's challenges, the most powerful storm in half a century lashed the south of the country, wiping out entire towns. 6 years after the earthquake, Gloria Calixte is still living in this tent city in Port-au-Prince. She's about to have her 3rd child. She lives in a cramped shack with a leaky corrugated tin roof. She hasn't eaten all day, and she has no idea where she will have this baby or what she will do if she goes into labour at night.
For many Haitian women, especially those living in precarious tent cities like this that were set up after the earthquake in 2010, childbirth can literally be a matter of life or death. Getting to the hospital is no easy feat for women who don't have any money to live on. And even when you get to hospital, sometimes things aren't much better. The main public hospital was on strike for 4 months this year, and doctors say that there are still no medicines and things haven't improved.
Back at Cruel, there's another twin birth. This one isn't progressing though. Doctors decide to perform a caesarean. As many as 35% of births at the hospital end up being C-sections because many women are in such critical condition when they arrive. If babies are struggling after birth, they're taken to the neonatal intensive care unit, the most sophisticated in the country. Here, babies are evaluated and admitted if they need round-the-clock specialist care. Once out of danger, some premature babies are moved to the kangaroo ward, where mothers drip milk into their mouths with syringes so that nurses can check how much they're feeding. Kayan is leaving with her newborn twins and her husband. A neighbour has come to take them to the house where they live with their eldest son, who's now 14. Kayan's husband, Adrien, rebuilt it after the earthquake destroyed their home and they spent 5 years living in a tent. After the shock of finding out they were expecting twins, and then the stress of trying to find a hospital for his wife to deliver at, Adrien is relieved and thankful for the care at Cruel. And now he can start to dream.
Je voulais être médecin, mais dans le temps, à cause que j'avais pas assez d'argent, j'ai échoué. Tu vois, j'ai échoué. Mais comme maintenant j'ai trois garçons, j'aimerais peut-être 1 ou 2 médecins, ou bien un ingénieur, tu vois, et puis un architecte ou bien, mais beaucoup.
After the fear and the pain, there is relief for preeclampsia patient Elda. She has successfully given birth to a healthy baby boy and is now ready to go home. Life is a struggle in Haiti that starts with giving birth, and all too often that can be a lottery. Jude Webber, Financial Times, Haiti.